Hello, my name is Natalie Aluo, and I did my internship at the Raphael Community Free Clinic. The Raphael Clinic is a caring Christian environment that assists the medically underserved, meaning it serves people without insurance. Though there is some limitation to what the clinic can do, it still is able to provide quality care to the Kerrville residents. The Raphael Clinic was founded by Sister Marge Novak and Sister Marianne Gardina, with the purpose of using this clinic to help the residents in Kerrville without any insurance. The meaning behind the clinic's name is based on the angel of healing named Raphael in the Old Testament. So, Sister Novak and Sister Marianne thought it was appropriate to name it after that angel. They knew there was a gap in the healthcare system and made the two wish to create a clinic to help the medically underserved. The Raphael Clinic accepts no funding from federal, state, or city governments, but relies on the generosity of donations from charitable organizations and private donors to be able to serve its patients. The purpose of the clinic is just like any other clinic. It takes in anyone without insurance, whether someone has just recently lost a job and lost all their health benefits. The clinic is there to serve its patients. When a new patient comes in, the first thing they are told is about a no-show policy. Because the clinic gets its funds from providers, it does not take light of patients who do not attend their appointment. So, with this policy, if a patient misses 2 of their appointments, they are not allowed to come back for the next 6 months and must reply again next year. This is so patients do not miss their appointments. Since there are patients who actually do need the appointments, the clinic does not tolerate anyone who misses. At the beginning of the day, I begin by organizing the diabetic charts into their proper categories, making sure to sign in patients and confirm that their charts were up to date. Diabetic patients are one of the top priorities at the clinic. Once they come in, their meters and charts need to be given to the nurses before they enter the patient's room. A patient's chart is basically all their previous medical history, the appointments they have had. If diabetic, they would have their evaluation inside and any other medical history and documentation that needed to be signed. The next thing in the day is to take telephone calls. A patient telephone call is one of the most important things to do while at the clinic. With these calls, you get patient info, the reason why they're calling, usually to tell us what symptoms they're having, if they want to be a new patient there, make an appointment, and more. The reason they are calling is very important to listen to because it helps the doctors and nurses determine whether or not the patient can be seen. After that determination, the application takes 2 weeks to process before patients are taken in. Afterwards, medical history forms are completed. To do this, a patient must write down any prior medical issues, surgery, or illnesses that they may have had, and whether or not their family members have any history. Once completed, financial forms are taken care of privately and signed afterwards to complete the process. The New Hope Counseling is a recurring Christian organization that helps the Raphael Clinic with its patients and emotional wellness. New Hope also helps its patients with their grief, loss, and anger management, ADD, parenting skills, and more. During this time, I had to work in the front more often because there were many at-risk volunteers who could have potentially gotten sick with the virus if a patient came in with it. At this time, we started requiring patients to use hand sanitizer, face mask if they were coughing, and taking temperature before they enter the patient room. Many issues with patient medication and patients wanting their medication now occurred, but it was handled. Though it was a little struggle to get everyone's needs in fear that they could potentially get the virus, the clinic still took extra precautions to make sure no one got ill. With that, the clinic closed early because they felt like they could have risked both the workers and patients who were at higher risk for catching the virus. Financial forms are done privately. Patients are required to bring paperwork such as W-2s or tax returns or anything that can explain their financial status. This form is the final step to do before patients are seen. So it is very important for patients to have the necessary documentation before coming in. Prescription refills are usually done on the phone or in person. To do a patient refill, I usually ask for how many refills they need per medication, their name, their date of birth, and phone number, as well as the RX number or ID number of their medication before it is processed with the pharmacy. Again, because the clinic is not funded by any federal government, it depends on sponsors to be able to function. So, sending mail to the sponsors or people who fund the Raphael Clinic was also another part of my day. Without any donations, funding for the clinic would not be possible. Medication would not be given, diabetics would not be able to get their pins and strips, and more. A memorable learning experience was handling patients. Handling patients became difficult when communication was not there between both the patients, the doctors, and the nurses. It begins to create a lot of unnecessary issues, but it also depends on the patients being able to read the rules and understand them. Speaking another language was also another learning experience for me. The clinic predominantly took in residents with Hispanic heritage, and most of the time, Spanish was their one and only language. Miss Maria, a current volunteer who speaks Spanish, was more prone to teaching me how to communicate with patients if she wasn't there. Things like using simple hand gestures could make the transition a bit easier. The more I was around Miss Maria, the more I started to understand patients, even if I didn't speak the language. Communication with everyone in the building and asking questions, even if I've asked them before, was another learning experience. If you don't know or give your own answer, this could hinder the clinic and the patients. A lot of nonverbal communication between me and the patients who primarily spoke Spanish or a different language also occurred. Usually a patient would come with a translator, but occasionally something may happen and it's up to me to be able to communicate. Another skill is organization. The clinic has its own system to organize. Whenever entering a new area, I must be able to understand that people have their own way of organizing and should be able to adapt to how they do their things, just like they should vice versa. As a person who wants to be a research scientist, there is a connection between being able to communicate with coworkers on whatever topic that is being researched. To do that, I need to be able to be confident in how I speak to others and know knowledge beforehand. Work must be completed efficiently and quickly so the process can be continued on. Being bilingual is another connection that I wish to work on, especially in a world where languages transcend all. Not being able to help someone because they do not speak your language is not the way of a health professional. During my time at the clinic, I overheard many doctors get assistance from other nurses to be able to communicate with their patients before someone else could come in. Being able to work out the differences in language can greatly help both the patient and the healthcare worker in the future. In conclusion, working at the clinic was fun. I was able to learn many things, meet many wonderful patients and workers and volunteers. I was also able to get a glance at what I wanted to do in the future and if this profession was made for me. It was boring at times with less patients, but then it became overcrowded and active the next. It showed me how helpful a community-free clinic could be and how impactful donations are.